Welcome to our 5 on 5. We're pleased to be joined by Alicia Tyler, a Providence Emergency Department patient guide. Alicia, great to meet you. Thanks for coming in.
Yeah, thank you.
So tell us, you've been trained for a unique position in the affordable healthcare system. Tell us what exactly you're going to be doing.
Well, my job is through Jackson Care Connect, which is one of the CCOs that manage Oregon Health Plan, and I help patients connect with primary care. And so regardless of their insurance status, I'm able to go in there and have a conversation, see what their needs are, and identify maybe any barriers they may have to getting primary care, and then hooking them up and helping them facilitate making appointments and really making sure that they have a good home, a good medical home.
So how do people get in contact with you? They call you, or do they meet you when they walk into the hospital, or when they're in the ER? I mean, how exactly does
well,
that
they come through the emergency department, and maybe the provider, the nurse. Sometimes I just look and kind of pay attention to the board, and I might see somebody who looks like they could use my assistance, that maybe they don't have insurance, or they do have insurance but they have no primary care established. And then I ask the provider for permission to talk with the patient and say, is it appropriate for me to discuss this? And sure, most of the time it's fine. I go into the patient and say, hey, you want help establishing primary care? What can I do to help you do that today? And most patients are really excited about having somebody help facilitate that, especially for uninsured patients, just because they're not aware most of the time of the resources available. They think, I don't have insurance, so I can't go anywhere maybe but the ER for my care. So once they know what their resources are, most of the time they're super excited and they're happy to have primary care.
And I believe, correct me if I'm wrong, but it's a relatively small portion of the population that you're going to be helping, because not everybody needs the help that you provide, correct?
Correct. So it's just mostly dependent on what their needs are, or maybe if someone realizes that they have a complicated health issue and they're coming to the ER and they don't have a primary care. Statistically, it's much better to have primary care. It's better health care for the patient. It's lower cost for the patient. And once they have established in the inside of the medical community, then they have better care. Their outcomes much better.
Very good. All right, well, we're going to take a quick break. We'll have much more with Alicia in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Alicia Tyler, our Providence Emergency Department patient guide. But Alicia, you're not just working in the emergency room, correct?
Right. I actually follow up with patients after they leave the emergency room, so I can call them, see if they've had any barriers to making with that appointment, or if maybe they don't feel comfortable with that provider and I need to help them facilitate an appointment with a different provider. So I do follow up at 10 and 30 days with the patient and see where they're at and if they need any more resources to help them stay established with primary care. Very
good. Okay. Now, will this mean emergency rooms handle patient care differently on their end?
Not really. I mean, every patient that comes in gets treated. Every patient will see the same kind of care. This is just an added bonus of having somebody help them with other resources, with establishing that primary care and knowing where they can go.
What do you foresee as the major hurdles you're going to have to clear in order to get people on board with this?
The biggest hurdle right now in Jackson County is just not having enough providers and that can see patients within a relatively short amount of time. So if I have somebody who's really sick and comes to the ER, needs follow-up within a few days, and they don't have a primary care, sometimes it's hard to be able to get them an appointment within quickly, just because there's not enough physicians in this area. So I know lots of people in the area are working on that, including Providence, with recruiting physicians and other clinics in Jackson County. So.
And of course, outside of the politics, within reference to Cover Oregon and the Affordable Care Act, what you're going to be doing in the hospitals, what do you think people really need to know above all else?
That everyone in the community is really working on making sure that every person in Jackson County has a primary care provider. Most agencies, that's their goal, helping patients have primary care, because it is the best patient care. It is the best way to manage their health.
Very good. Alicia, great to meet you.
Yeah.
Thanks for coming in.
Yes, nice to meet you too.
All right, stay with us. We'll be right back.